Welcome to part 4 of our video series. This is an advanced hormone testing tutorial, and in this particular video we're going to give a brief introduction to monitoring BHRT with our testing, the dried urine testing for comprehensive hormones, a Dutch test, as well as serum and saliva and urine testing. We're going to go through these different scenarios of HRT and how are we taking this HRT and what happens to serum testing, what happens to saliva and traditional urine testing, and then some of the unique features of our testing for monitoring these different situations. You can take hormones a lot of different ways, and each of these is unique, and so we need to navigate these, and so we're going to navigate these in individual videos for each one of these so that you can understand which scenario a particular test is effective for and where there is a problem. And the model that we're kind of using when we look at hormone testing is this, is we've got a normal range. If we've got, let's say, a premenopausal woman who's got progesterone, let's say that's normal, and then she hits menopause or something happens to where she's not making progesterone anymore and she's deficient. And then if you don't give her enough hormone, she's not going to get into the target value that you're shooting for. If you give her too much hormone, obviously there's going to be a problem there in terms of excess hormone. And so as providers, you're looking for that dose that's just right, not just generally speaking, but for a particular patient, because if you give multiple people this same dose of hormones, you're going to find that some remain deficient for hormone and some are going to have an excess with that same dose. And so we're going to use the lab testing to see that where we hit our starting point with the dose, do we end up in the place that we want in terms of our target values. The problem with that is in some situations you have what we like to call testing minions wreaking havoc on your ability to monitor systemic levels of hormones, where you may get an elevation that's not due to a situation where you have a legitimate excess of hormone, but a situation where there's something going on there that's actually giving the appearance of an excess that's not actually real, or a situation where you actually end up getting a result that is a false low, and your systemic levels of hormones are actually much higher than what the lab result would imply. And we need to be careful in these situations that we're not getting false lows or false highs because of what I like to call testing minions, things that are going to wreak havoc on your ability to make a good decision for your HRT monitoring. And we can see these most notably here in this matrix by the areas that are black. So if you look at an area where, let's take it as an example, sublingual hormones and saliva testing. That is a bad combination where we've got a problem. And what is that problem? The problem is if we give the just right dose, let's say we're taking progesterone and we give 20 milligrams or 50 milligrams or whatever it is, that's actually going to result in skyrocketing levels of salivary hormone. Why? Because you just put 1 billion times more hormone than is typically in your saliva, in your mouth, where your saliva comes from. So obviously the value that you get is going to be very, very high. And we're going to go through the particulars of that when we look at sublingual hormones, but it's just a very easy example of where saliva testing is a bad match for sublingual hormones. It's not effective for taking a hormone, getting a lab value, and changing your dose. And what we'll see is there are a number of areas where it's difficult to the point where it's really not recommended and where you can actually make decisions that are negative for your patient. Those are the areas that are black. And we're going to, again, go through each of these as individual topics. And then there are areas where there are some caveats that we want to be cautious when we're doing the testing and understanding what's going on. Those are the orange areas there. And then there are the green areas where really you can find excellent correlation between the lab values that you're finding and what's going on with the systemic hormone levels. And those are areas where we can really make better decisions by using the lab testing. And so we want to know this information if we're going to make effective decisions for our patients. So in the next 6 videos, we're going to go through these different situations, and it'll really help you to navigate those as you're making decisions for your patients. So I hope this has been a helpful little introduction, and please do go through at least those videos that represent what you might do regularly in your practice so that that you'll be able to confidently make decisions as you go about adjusting dosages based on not just the clinical picture, but also what's going on with laboratory testing when that's appropriate. So if you have any questions, feel free to reach out to us at info@precisionhormones.com, and we really hope you'll continue through this series to the end, and we thank you for your time.